Hi, I'm Lola Forester. Welcome to Jab Jabber. I'm speaking with Lesa Towers. Lesa, welcome to the program. Can you tell us a little bit about yourself?
Sure. I'm a proud Aboriginal Awabakal woman from Newcastle, New South Wales, and am currently living on Gamilaroi country, and I work for the Western New South Wales Local Health District, and my role at the moment is the manager of the Aboriginal vaccination program, leading a team of Aboriginal vaccinators to deliver COVID vaccination services across our Aboriginal communities.
So what is working?
We're actually working with many of our communities, so we're partnering with our local Aboriginal medical services. We're also working with some of our local Aboriginal land councils and getting support from what is a community-led response, and so working in with each community and understanding what their needs are in terms of Aboriginal vaccination, and whether or not we need to work with them to increase the uptake in their local GP clinics or their local pharmacy, or whether or not we need to provide a more specialised service and provide some flexible service delivery, whether or not that be in the home for many of our frail elders that may not have the abilities to travel. And we will happily go and make considerations so that they can have their vaccinations in the safety of their home, particularly for those that may be immunocompromised or undergoing other chronic disease treatments, particularly in our oncology patients, and looking at how we can better get access for those patients.
What's not working, or what do we need to do more of?
Really encourage the uptake in our younger generations and looking at how we can better support them in their understanding, and especially the hesitancy and the fear of the unknown. This is something we haven't been through before. So for many of our communities, this is something that is quite scary for them. And so we want to make sure that we're able to provide them with the opportunities to get the right information for them to make the right decision for them and their families.
So what's it like now?
In the Western New South Wales Local Health District, we have quite an increased supply of vaccine through a number of different channels. Access to the vaccine is quite good at the moment. It's just making sure we've got the right information in the communities, reaching to the people that need it.
So why is it urgent for community to get vaccinated?
You know, the rules of opening up in New South Wales are in, and with that we'll have a little bit more flexibility around travelling and visiting family. So I guess the urgency is to help protect our communities and protect our elders and those that we love and are close to us. We need to really strongly encourage people to do that, particularly if they want to start participating in more community activities. So we're really strongly encouraged for our mob to get vaccinated and protect each other.
How do we get the jab?
For those that want to have the jab, we can work in with your local Aboriginal health workers or your local health professionals. They can certainly encourage you to participate in whether it be one of our clinics or through one of the GPs, through the Aboriginal medical services, or through their pharmacies. So I guess it's a matter of reaching out to your local Aboriginal health professional, and they'll help guide you into the right direction of where you can access that in your community. If it's easier for us to go and bring the vaccine to the home rather than have them coming out into community, then we'll adjust our models to make sure that that can happen.
Are the healthcare workers that are going out house to house, are they all First Nation people?
My team are First Nation people. We do have, clinicians that support the clinics, and we certainly provide them with a lot of cultural support and cultural education prior to them going into some of our communities so that they get to understand what our community needs.
So Lesa, what more are you doing to help our more at risk to get vaccinated, especially our elders?
In Western New South Wales, a lot of our elders have really taken up the challenge and led by example in their communities and have strongly encouraged the younger people to be vaccinated and are generating that word out in the community to get out there and protect the mob and protect the community. To get that coverage that's sufficient to protect the whole community, we really need younger generations to come forward and do their bit to protect our elders as well.
So what's the current situation like for sorry business and, say, travelling to funerals?
I guess because of sorry business and the sensitivities around that, I'd strongly encourage people to reach out to their local health workers and local health professionals to really understand what the rules are for your community and to be able to practice and put those things in place.
Lesa, thank you very much.
Thank you.
That was Jab Jabber, an interview series produced with support from the New South Wales Government.